So let's go around the room and introduce the other PSTA board members. We'll start with our CEO.
Hi, good morning, everybody. I'm Brad Miller, the CEO of PSTA.
Good morning, Mike DeBreezy, City of Largo.
Chris Shear, Pinellas County Commission.
Barb Hazelton, citizen appointee, Pinellas County Commission.
Max McCann, citizen appointee of St. Petersburg.
Thank you. Before we begin, can we have a motion to allow Commissioner Rob Walker to join virtually?
So moved.
And a
Second.
second. Thank you. All in favor?
Aye.
Opposed? Now is the time for public comment. Are there any members of the public who wish to speak on any agenda or non-agenda item? Seeing none, I'll close public comment. Moving on to 3 action items. Do I have a motion to approve the May 13th meeting minutes?
So moved.
Second.
Thank you. All in favor?
Aye.
Opposed? Motion passes. Thank you. All right, Trish, our Director of HR, is going to talk about our Employee Benefits Renewal Program. Hi, Trish.
Hi, good morning, everyone. I'm Trish Collins. I'm the Director of Human Resources here at PSTA. And today I'm actually joined by Sean Fleming. He's our partner at Garing Group, who's PSTA's benefits broker. He's here in the audience. There we go. Today I'm bringing forward an important item, which is the plan for our medical benefits, medical, dental, vision, life, and AD&D insurance for FY27. This benefits package is an important part of our competitive compensation that helps us attract and, importantly, to retain our great employees. We're bringing today a recommendation to approve renewal of our insurances with our current vendors. So as you can see on the screen, this is Cigna for our medical and prescription coverage for a not to exceed employer amount of $11.4 million. Also Cigna for our dental coverage with an employer cost of not to exceed $200,000. Versant MetLife, which is our vendor for vision insurance at an employer not to exceed cost of $50,000. And Oaks Minnesota Life, which is our life and accidental AD&D insurance provider at an employer cost not to exceed $85,000. Those of you who represent municipalities probably know from your own areas that insurance rates are driven by claims costs and loss ratios. And unfortunately, PSTA has had several years in a row of climbing claims costs and unfavorable loss ratios. So this influenced Cigna's first renewal proposal to us of a 15% price increase. With the Garing Group's help, we were able to get that lowered to 12.5%. And then by making some very significant changes to our benefits plan, we were able to get that to an even lower rate. Those changes in the benefits plan that helped us achieve that included increasing the out-of-pocket maximum, increasing the plan year deductible, increasing co-pays on services and prescriptions. We also changed the formulary, and that is the list of prescription drugs that are available to insured members under the plan. And by making all of those changes together, we were able to get to a final negotiated offer of a 7% increase. This is in line with what our local public municipal partners are seeing, which are also in the single high digits for next year's plans. As always, the cost of this increase is shared between PSTA and our employees. So our rate is going up and the rate that the employees pay out of their paychecks is going up as well. And as you know, our union is an important stakeholder in these discussions. And they agreed that this lowest cost option was the best plan for both PSTA and employees to help ensure affordability into the next year. I'll also note that the only increase is in the medical and prescription plan. There were no increases this year in our dental, vision, or AD&D insurance. So we believe that this is the right recommendation for FY27 that balances good coverage for our employees but at an affordable cost for PSTA and those employees. The increase that we're proposing, this 7% rate, is included in the proposed FY27 budget and does fit with our plans that we'll be bringing forward with that budget very soon. So to recap, we are recommending approval of renewal with our current vendors at the exhibited not to exceed amounts for FY27. And lastly, I really just want to thank our partners at the Garing Group. They did great work negotiating with our vendors to get the renewal rate cut in half, and also really helped us look at all of the options that were on the table for getting the best plan that we could for this upcoming year. So with that, I'd like to turn it back over to our chair for discussion.
Thank you, Trish, appreciate it. Before I ask for questions, I've got one. Of the 11.7 roughly, how much of that, what's the average cost per employee from our side?
From our side, every employee has the option to choose whether they're covering themselves or family
Right.
members. And then they also have the option to choose between 3 different plans, which have a mix of how much they pay in premiums every month versus their copays and deductibles. So there's quite a variety
No, I
of
understand
costs
that,
for
I'm just curious
people.
what the average cost to us is per employee,
Oh, to us.
regardless of what plan they're on, because it's factored into the cost.
I'm looking at our list of our cost per employee for the proposed next year, and the average is around $1,700 per month per employee.
That's really high.
Per month.
That's extremely high.
What is the percentage that PSTA pays towards the, what is it, a 60/40, 50/50?
It's about 84% PSTA and 16% employees.
That's for the employee, not for the family.
When you look at the entire cost of the proposed plan for next year, that's how that breaks down.
Any,
Yeah,
Mr. Shearer?
I think what would be simpler, how many employees are covered?
580 employees.
$20,000 employee per year? So that could,
I'm sorry, I don't have that figure right in front of me.
Well, if it is 580, then you just take the
There are
cost.
other dependents and things that are not in that number.
Well, no, but
That's
the
true, it's
overall
580
picture is still
employee members.
Per employee, what does it cost? You take the cost and divide it by the number of employees, regardless of whether it's family or individual plan.
right,
So,
Actually,
$1,686 a month, there's your $1,700 you're talking about.
Roughly.
Commissioner Breezy, I'm sorry.
I have another question, but follow up that. So we contribute to dependent coverage, correct?
We do, we pay a portion of the monthly cost for
That could be
employees
why.
that cover dependents.
Leads to the higher cost because we probably contribute pretty. So we started with a 15% or so increase because I'm an HR nerd. Do you know roughly what the claims to premium ratio was at the renewal?
I do. As of March 30th, which was the most recent report that we'd received, inclusive of catastrophic claims was 114% loss ratio.
Okay.
Yeah.
No wonder you got a 15% increase. All right. Which is actually not that bad considering it's 114%. And they get it down to 7. Okay, that was it. I was curious of that. If you were to tell me like 70 or 80, 75% or something like that, I would have said, they got no business giving you a 50% increase, but
Right.
it makes sense.
With this plan, I'll just add, one of the ways that we were able to get to that lower 7% increase is by shifting more of the cost and more of the risk to employees. That's what happens when you increase the out-of-pocket maximum and the plan year deductible and increase the co-pays. So more of the burden, more of the risk and the cost is being shifted to employees.
Any additional questions? Commissioner McCann? I'm sorry.
That's right.
Just a quick comment for what it's worth as a state employee. I know I've looked at my loaded rate, meaning salary plus benefits, and it's comparable to this. Take that for what it's worth. I guess the answer here is trying to get the claims rates down. And so I support whatever we can do to accomplish that. I know you're already thinking about it, so that it's uncomfortable. I just don't know what else we can do except try to work on those claims. Yeah.
Good point.
All right.
Commissioner Scherer?
Yes, Chair. Did you provide us with a list of coverages, what's actually covered? I didn't see that in the, like, are there a lot of,
That is
sometimes I like to go through what they're saying,
Sure.
what could.
Yeah, I'd be happy to add that. We've got the plan description, what's covered, and also if you are interested in seeing the per employee costs, we can include all of that for you.
I just wanna make sure there wasn't a bunch of elective stuff in there,
Oh, sure.
Commissioner Parisi?
I'm assuming probably a lot of the prescription is a big driver in the cost.
It is,
Okay.
right.
I'm sure you have, but there are other, and we can talk, I can give you, but there are alternative plans that are, it's easy, I'm just guilty of it in my own company of trying to stick to the big boys and because it's comfortable for the staff and easy and for the employees, but there are other, it's getting very popular, prescription coverages that really drive down cost.
Mm-hmm.
So I can give you guys a couple names of ones that we've looked at too.
Thank you for that, yeah.
Any additional questions? Commissioner Walker up there, anything from you? Okay. All right, there's no more questions. Do I have a motion to approve the contract extension or renewal rather?
So moved.
Second.
Thank you. All in favor?
Aye.
Opposed? Thank you, Diane. Appreciate it.
Thank you.
I'm sorry, Trish. I'm reading the next line. I don't, that's a situation later.
No worries. Thank you.
Diane, come on and tell us to open up a piggy bank. She's gonna outline a claim settlement for us. Good morning.
Good morning. I actually have two claim settlements for you today. I'm going to do them separately because one is liability and one is workers' compensation. So because the coverages are so different, I'm gonna do them separate. The first one is the liability claim, and I'm seeking approval for a claim settlement in the amount of $75,000 with Sean Finley. This incident occurred on March 3rd, 2023, when one of our buses was trying to go around the plaintiff's vehicle on the right side through a parking area when the plaintiff made a right turn to park in a parking spot. Mr. Finley was 50 years old at the time of the incident and sustained injuries to his neck and low back, and his medical costs are approximately $71,500. The settlement is within the established claim file reserves, and settling will end all our future exposure. Therefore, I'm recommending approval and requesting approval for a claim settlement in the amount of $75,000 with Sean Finley. Any questions?
How fast were you going through the parking lot to have those kind of injuries?
I believe it was in the downtown area.
Okay.
So where you have the angle parking down there,
Okay.
that's where that happened.
Any other questions for Diane on that one?
I did have a
Go
question
ahead.
on that.
Commissioner Chair.
Why do we in these meetings make the claim settlement numbers public? We don't do that at the county. The attorney passes it around and we don't announce to the public what our settlements are.
As far as I'm aware, it's part of the way that the charter is set up, the rules of.
I mean, typically, it's a good question, but I can talk to the
I think
attorney
we
about
should
that,
put
but whether we, I know that, for every other contract, every other expenditure, the rules and regulations, authorize me up to $100,000 in expenditure, budgeted expenditure. Then anything over $100,000 comes to the PSTA Finance Committee and Board, except for claims. That is set sort of strategically low at
25,000. So I have
So-
authority up to 24,999.99.
I'm just.
So that's why I know that's why a lot of them come here, but the idea is to kind of encourage settlement.
Right.
Yeah,
So I'm just,
they can get
Just-
this check.
you might wanna check with your attorney and see if at the county, we do a lot of settlements on sidewalks and stuff like that. It's passed around in an envelope and then the attorney asks for approval and we all sign but it's never public record, so Just wondering.
So are
Do you
you
do
doing
that
them
at
in
the
the
city?
shade?
Ours ends up on a consent agenda usually, so, it's there, so if somebody wanted to, it's public, it's made public, but we don't necessarily talk about it too much, like it's pulled.
I'm not recommending a course of action, it's an observation,
I'll find out. That's a good.
something you think about.
Any additional questions, Commissioner McCann?
I'll respond to that. I'm surprised that the county doesn't publish those settlements. I'll say any body of government I've worked for, we've had to publish those settlement numbers because, under the theory that the public has a right to know where the money's going.
But is
So-
it in the minutes? Is the numbers in the minutes of the, for me?
I've never seen the numbers published at all. Have you?
Yeah, that I'll just say that seems like the outlier to me, the way the county does it as opposed to the way PSTA does it, for what that's worth. Even when we've had plaintiffs request that the amount be held confidential, we couldn't do that. Because it's, and I'm not aware of a public records exemption that would cover a claim settlement either, for what that's worth. But maybe there's something specific for the county.
The public records protects our file in the sense that if someone requests the notes or the any documents that we have in our file until the file is closed. And so once this is the point of closing. So I don't know if we cannot protect it once it's closed.
Mhm.
Once the file is settled and resolved, we can no longer protect it.
Are we to take action on these individually?
Yeah.
Yes.
Okay, so do I have a motion to approve? Or are there any more questions? I'm sorry. Okay, seeing none.
So moved.
For a second.
Second.
Do we need to do both at the same time?
No,
Okay,
that's what I just asked her.
gotcha.
All in favor of approving the case for Sean Finley, say aye.
Aye.
Opposed? Motion passes. Thank you, Diane. We'll go on to the next case.
Okay. Well, this next case is a workers' compensation claim settlement with prior employee Anita Williams Jackson, approving a settlement in the amount of $50,000. Ms. Williams Jackson was employed with PSTA from January 7th, 2013 through May 14th, 2024. During her tenure, she had 12 claims that were reported and she sought treatment on every single one of them. We currently have 4 claims that are still open for her, going back as far as 2015. They're all open, active, and fully litigated. These open claims involve injuries to the shoulder, neck, arm, and knee, with the shoulder and knee claims both having surgical recommendations. We have been contesting them as not being related to our compensable injury, so settling on a compromised basis will end any future exposure, and all 12 claims would be included in the settlement. These cases are within the established claim file reserve, so therefore I'm recommending that and requesting that we approve settlement in the amount of $50,000 with Anita Williams Jackson.
I'm guessing everybody's probably got the same question in their mind that I do, and that is, how does somebody get 14 workers' comp claims? I mean, at some point, doesn't HR say this is a person fishing for a settlement?
The second one, yes.
We had, there was a period of time that we had some issues with employees having FMLA, and then as soon as their FMLA ran out, gee, look at that, a work comp claim. We have been dealing with that and it has been greatly reduced. This is one of those situations.
Does anybody else have any questions?
Without going into detail, sorry. Without going into detail, was she in an accident or just?
Very, very, I think maybe one was an actual accident, everything else was a seat pulling a button.
Okay.
Walking.
Chairman Fig Sanders, did you have a question?
Thank you. So I did have that same question in mind. So there were 12 cases?
12.
12, and
She was here 11 years, so she was averaging at least 1
One
year.
a year. So with that same question in regards to when do we do a red flag, was it the consideration, and I don't know if you can answer this, was it the consideration of legal advice that we would not want to seek any other type of order or judgment based on the number of workman's comp? I don't think we can.
You can't,
I didn't think we
workers'
can.
compensation is a no-fault coverage.
Okay,
Meaning basically if they say they got hurt, you have to address it.
mhm.
We do that and everything is based on medical evidence, so.
So that was the answer that I wanted for Chair Reed, because we can't. I know 12 seems like a really large number of claims, but as an organization, we couldn't red flag it and say we're no longer gonna process any more of your workman's comp's claims, so
we
I didn't think we
can't do
could.
that. However, when we see, and we meet quarterly with the operations to try to avoid situations like this so that we're all aware of what's going on. And we have meetings talking about trending and, if there's specific employees that we need to address issues with, we discuss all of that there.
Okay, but I just wanted us to put it out there that we couldn't just cut her off with every claim as long as she's still employed,
I guess you should use it as a form of job protection as well.
Yeah,
so.
and additional
And
questions?
workers' compensation is designed to protect the employee, not the employer. So it's kind of like tie goes to the runner, tie goes to the employee.
Any additional questions? Do I have a motion to approve? Do
So moved.
I have a second?
I can't second, otherwise I would. I'm the alternate today.
Oh,
All in favor?
Aye.
Opposed? No. I'm a no.
I'm a no.
Wait, I'm sorry. No, and Commissioner Shearer?
No.
You say no? Okay.
I didn't hear your vote.
No,
I lost a vote.
I'll just expand on that a little bit. This is clearly to me, it's probably an outlier, but I think we should defend ourselves in this. I mean, it may cost us more money, but we need to send a signal. 12 workman's comp claims is just ridiculous. And you just said reaching, it's not like there was an accident involved. I think we need to defend this to the fullest.
Sure.
Go ahead.
If I may, could we hear a little bit about what the alternative would be if we don't approve?
We've already settled it. We've taken a vote.
Okay.
I
I'm considering changing my vote to
Commissioner
no.
Breezy, I wasn't sure what your vote was.
I can't, I'm the alternate
He's the
today,
alternate.
so I'm out.
Oh,
So let's just raise our hands for, let's go around. Commissioner McCann, go ahead and ask your question that you were gonna.
If the board votes no, we proceed with further litigation?
Correct.
I'm a no.
There you go.
no.
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 There you go.
Yeah.
Thank
okay, so
you.
it's all no's.
Thank you.
Okay. We got
Thank you,
it.
Diane.
I'm with you. Let's fight it.
Go. Next up, our CFO, Debbie Elias, will give us an update on the fiscal '27 budget.
Well, good morning, everyone. Happy to be here and probably a little better news than Diane, so I like to follow her sometimes. So every budget, I've been doing this for a number of, I hate to say decades, but a number of decades. I started as a child prodigy, I like to say that. So some of our challenges we have are really positive challenges, like trying to get grant funding for a project that the board wants us to move forward on. Other challenges like this year were unexpected challenges. So as we all know, we've had rising fuel costs this year. We just had a great presentation by Trish on health insurance and why those costs were going up significantly. So we had quite a bit to overcome. But with collaboration, which we always do, but it was really extra this year between all the staff members and coming together with savings across the board. But also we were able to eliminate a headcount 15 people from a headcount perspective. We were also able to work with the union, and I see our union representative is here and the health insurance side because they are a big stakeholder in this, to help get to a point where we were high to at least a reasonable amount in the state of Florida. The board has had a huge impact, not just this year, but through the years. The board has made decisions through the years that we should have a mixed fleet of vehicles, meaning that we've got diesel, hybrid electric, and electric vehicles. The decisions you all have made have helped to mitigate the cost increases this year, even though they are high. In addition, we've held a couple workshops, and I really want to say I appreciate what you all have done and brought to the table. We were able to calculate some savings that we'll talk about a little bit later. And putting all of this together, we were able to come to a balanced budget with a slight surplus. Now let's just take a look at the chart on here and what are the important points on here. In fiscal '26, we adopted a budget that had a slight surplus of $162,000. Our projection this year, $245,000. So we're doing a little bit better than we had anticipated. And the proposed budget for '27 has a slight surplus of $231,000. So that's the good news takeaway on this, but I'm going to talk a little bit about how we got there, what are the key challenges. So let's start with revenues. Revenues are going up about $8 million year to year. What I really like about this chart is when we talk about operating revenues, which is our fare box revenues. We are seeing fare revenues going up, and with the introduction of the new Tampa Bay service, we're also going to see increased revenues related to that. These are things that are operating related, and we're excited to see that those are going up $2.3 million. On the non-operating side, we are also using the last of our COVID relief funds. So I've got the last of that in there. These are one-time funds of $6.2 million in the budget. I've also increased because we had a little bit of a backlog of state block grant, which is recurring revenues. That's in there. And we also have some grants that we get from the state of Florida that we're going to be using up, so that kind of counterbalance that. So we're seeing revenues going up both operationally and from a grant side. So here's something, I'm preaching to the choir and talking to the choir on this, and something we all know. Property taxes, the hot topic this year. So when I take a look at the last 10 years of where we came from a median home price of $183,000 all the way up to last year of $430,000. The home value as a homeowner, I've seen my values go up, but we've also seen an increase in property taxes. The increases in taxes do not even compare to what the increase in the value of the home is. However, property tax is a huge part of our revenues here at PSTA, just like it is with the county and the other municipalities. So when we look at how a dollar is split up, and where do we fall in here, we're at the end here at about 3.7%, so 3 to 4 cents of that dollar relates to PSTA, and yet it provides vital service to the community that we serve. I'm sure all of you have seen this chart for those of you who are at the workshop or have been looking at this in your own municipalities. And if you haven't seen it in your municipality, the property tax appraiser has this on his website. It's a Power BI tool you can put in your municipality, and it will tell you what the impacts are. So for here at PSTA, the impact, if this passes the vote in November, will be the first year of impact, which would be for us fiscal '28, will be $15 million, increasing all the way to $22 million in the following year. Those are significant, and we are working on putting together what those impacts will be to the public that we serve. So right now in the budget, I've got the millage held steady. When we had the workshop, I would say, for the most part, we were split on those who said keep it steady, those who said roll back a little bit if you can. I think we had one person say let's increase it. So right now I've got it held steady for the max millage in July. You'll see on our next steps, we'll be working on this through the summer, and when we get to fuel, I'll talk a little bit about there may be opportunities for some recurring savings that we can look at with the millage. So let's take a look at the expense side. We saw revenues going up by 8, we're seeing expenses going up by 8. What are the 3 top key areas up here? Salaries. We knew that was coming. We planned for this because the majority of our people are in the union. We're talking about that. We knew that was coming. That was anticipated. Health insurance, which is part of fringe benefits, that was a surprise. And then fuel, of course, $2.9 million increase in fuel. Did not see that one coming at all. So we also have some other ones on here, a little lesser amounts in ferry service, insurance, and utilities. So let's talk about expenses related to salaries and fringe benefits. Here at PSTA, that represents about 59% of our total costs. So we're very pleased to say we've lowered the head count here by 15. We have no new positions in the budget. So that is helping us to contain the costs. As I mentioned, we've got 2 unions here at PSTA. The largest one, they're both SEIU unions. The largest ones include operators, customer service reps, and mechanics. That contract expires at the end of our fiscal '27. Currently, the top rate is a 4% increase, which is where the majority of the operators sit, is at the top rate. What we're looking at on the supervisors, which we're in negotiations for, we anticipated a 2% increase given the economic environment. When you put all these together, salaries are increasing $2.6 million. Fringe benefits, I won't spend a lot of time on this because you did just hear from Trish, but we were able to really get these numbers down. But let me put a little context to that. When we started out at 15, when we came to you in one of the workshops, it was at 12.5%. That represented a $1.5 million increase. Now getting it back down to 7%, the increase in the budget is just under $600,000. So a lot of savings were had over the last month or two with a lot of work on everybody's part. One of the things we talked about, the changes in the out-of-pocket, the deductibles, but what didn't change were the benefits. So that was probably the most important thing to our employees, is to keep the benefits the same. At this last workshop, for those of you who are here, I appreciate y'all being here. We had a table with Bonnie on the mobility side. You all had ideas that you, as I called it, noodled over. We threw the noodle against the wall to see what would stick. And we were able to, with your help, save just slightly over $400,000 just in the last 2 weeks. So thank you very much for that. We saw savings on mobility on demand, on the grouper, and on the direct connect. What was important to me, because mobility is a large part of our budget outside of the route service that we have, containing the cost to a 1% increase is probably the best that I have seen in years. So appreciate the help. Fuel. I was personally pulling the fuel tanker and prices have dropped. As Sabrina said, I do watch the fuel all the time. I've now made a convert out of Jordan, who is with us today. And he's our new financial planning and analysis person. And he is now doing charts and graphs for me on the futures as we try to lock in. This is where I think I can save us some more money with the way the prices are going right now. We are budgeted at $3.50 a gallon. And that represents the $2.9 million increase. For every 10 cents that comes down, I can save the $133,700. And what do we do here at PSTA? I lock in fuel rates. This year in fiscal '26, you could see the huge difference. I was able to lock in $2.11. I'm not gonna get there this year, at least not the early part. But I'm gonna start locking in contracts as the prices are falling. What we usually do is about 2/3 of our fuel we lock in. All that does is basically protect what our budget is. Sort of gives us some solid feeling that things are gonna come within budget. For the other third, I have the option of locking in more or leave it float to the marketplace. So if the decisions I make on what I lock in aren't good, they're too high, at least I'm getting a benefit of 1/3, saving us money. So I'm also probably gonna look at some other options for things that I can't lock in, like gasoline. We don't have enough of it, so I'm gonna start exploring some other ways of saving money on gasoline versus diesel fuel. Insurance is increasing. 2 reasons, we're very excited to be having the Tampa Bay service start this year, but there's also gonna be insurance related to the vessels that we purchase. So that's one thing going in there. The other was this year, the legislature had changes to our sovereign immunity limits. So it went from 200 to 350,000 on the per person basis, 300,000 to 500,000 on a per incident basis. The result of that legislative change is an increase of about 20% on our insurance premiums and our anticipated claims losses. So in summary, I'm really excited that we were able to balance the budget. And we also have a lot of exciting things going on this year. We've got the Tampa Bay Ferry Service that we hope to start soon. We have purchased or in the process of purchasing the boats. And then we also have our 727 airport service. Essentially what we're doing is switching over from our 100X to the 727. That'll take us right to Tampa Airport. This is just one step. This is the first proposed budget. We're going to be looking at working on this over the summer because I do want to be able to say there's an opportunity to reduce the millage rate if possible. And as Commissioner Peters says, that way we could roll forward if it's possible to do so. We're going to be having public hearings in September, but I will be presenting another budget to you in August as the final one that'll be viewed by the public and discussed. And with that, I'll take any questions.
Thank you, Debbie. Appreciate your presentation. Does anybody have any questions? Commissioner McCann?
Hi Debbie, well, first, thanks for what you've done here. This is impressive. On page 15, we mentioned some mobility budget savings. Can you talk us through that? I know for mobility on demand, we talked about having a waiting period where people
Yes.
aren't eligible right away. Is that where we're seeing those savings and where are we seeing the other savings from on the other programs?
So on the grouper, we're going to be, I will say, right-sizing the service to eliminating some days on there where we don't have the high ridership. So that's gonna save us about $145,000 on Direct Connect. We're going to be eliminating some of our Direct Connect stops that are not highly utilized. So that'll help to save us money as well.
On the grouper, there's really, especially in the off-peak, non-spring break time of the year, there's very low traffic to San Diego Clearwater Airport on Tuesdays and Wednesdays. There's a lot of traffic on the weekends. And so instead of having the bus there for walk-ups, which is a very popular way that people use it during the spring break, we're not gonna pay for Tuesdays and Wednesdays anymore. And if somebody needs to go, wants to ride the grouper on Tuesday or Wednesday, they will get them in the cab.
Yeah.
So it's really no impact to the rider, but it will save us $144,000.
Any more questions?
Commissioner
Chair.
Thank you, Chair. Yeah, thank you for the presentation. Are you gonna give us, did you provide with this, an actual budget, for the whole year, with
Yeah.
line items?
Yes, that
I just
there
saw-
should be a budget book
Okay.
in there.
All right, good.
And then,
And then
yes.
I had a question on fringe benefits on page 11 under, the fringe benefits are 25 million. Now, we just went over the healthcare costs for 11 million. Is the rest of it
Pension?
pensions? And,
Social Security,
okay, Social
Medicare.
Security's in that?
Social Security, Medicare, FUTA, which is your federal unemployment, and SUI, which is your state unemployment insurance.
Okay.
Mhm.
I didn't know, do you have a breakdown on that anywhere?
I can get you a breakdown.
Okay, cool, I
Yep.
just wanna see. And then, I was also confused about your number of employees. You said we had 655 on one of your slides, but we just talked about health insurance, we only had 5.
Not everybody, not every employee has a health insurance through PSTA.
Okay,
We do employ some veterans that are covered under TRICARE. We also have people who use their spouse's benefits as well,
Are they part-time or are they full-time?
full-time.
Good. That's all.
That's the new roof.
That was the fuel prices dropping as we spoke.
Hopefully it's fuel.
Anybody have any more questions for Debbie?
Just one more, Chair.
Go ahead, Commissioner.
Okay, want to say I'm excited about the 727 service starting up. I'm personally going to benefit from that, but I think it's also going to be good for the public. And then I'll make my regular pitch to trying to go to 10-minute service on the Sunrunner. Part of making our network more efficient is slimming back the services that are not working, like the grouper, but also investing more in the services that are working, like the Sunrunner. It's got our highest ridership, among our highest ridership route consistently, and one of our least subsidized routes, if not our actually least subsidized fixed route, I think. So it's been a success. I think we should invest more in it. And the great thing about going from 15-minute to 10-minute service is then you're not checking the schedule. You're just showing up. And on-time service starts to matter less and less as you increase frequency. So if it's late, but there's one coming every 10 minutes, who cares? You're still gonna get on time, but you're still gonna get an effective product, and the research I've seen has shown that you can expect significant ridership increases from that. So it's my pitch. I hope we can get there one way or another. Thanks, y'all.
Thank you. Commissioner Hazelton?
Yes, thank you. I just have to say that what comes to my mind on 15 to 10 is the amount of money that was invested in this platform stations to get out of the elements. So 5 minutes, there was, Brad, millions spent on these Sunrunner platform stations.
It was $41 million.
$41 million. So here you have these beautiful covered, they're darn near air conditioned with a restroom. They're so nice. And so I think that, going from 15 to 10, we'd have to look at how many more maybe buses and drivers and.
Yeah, we've looked at that. We don't think we would need more buses.
Pardon?
We would be able to do it with no more buses. Yeah, I think you'll see it in a presentation later this morning from Devin. The idea with adding frequency, having the buses come more frequently is what leads to higher ridership. That we're seeing that across the county, and all the services that we increase frequency, the ridership went up.
Mhm.
When we decrease frequency, the ridership goes down. So yes, you're right, those are nice places to hang out and wait for the bus, but if you have the buses come more frequently anywhere, including the Sunrunner, more people will say, Commissioner McCann said, I don't need to figure out the schedule. That's easier for me. I can just go to the beach. I can just go wait there. No problem. More people will ride.
Yeah, no, I get it.
Yeah.
I just want to consider the investment made by the taxpayers to provide, probably one of the nicest platforms in the United States throughout the Sunrunner route.
Well, as somebody who takes a Sunrunner frequently, 15 minutes is fine. What's an extra 5 minutes? Seriously, it's under your shade.
You're in the shade.
If you think about it, 15 minutes, your average time is 7.5 minutes. I get there, I don't think I've ever stood under one of those things where the marquee says it's longer than 8 minutes. So, anyway, I think we're straying out of the finance committee's realm right now. So, Any more questions related to the financing?
Terry, so as Debbie said, the game plan from here on out, this month, next week at the PSA board meeting, Debbie will make this draft presentation. And then to the whole board. And then July, as you know, is there'll be a vote on the maximum millage for the trim notice. And I'm sure we'll have discussion there. In August, my hope is that we will actually make in addition to sort of the final budget proposal, we will also present the impacts, more specific impacts to if the property tax ballot initiative passes. And and the $22 million hit to our revenue, it comes into play. Exactly how would that play out? We had a good discussion at the workshop about focusing on the core routes of the system. So the planning department is working on now to kind of lay that out. And then we would present that at the August meeting, sort of more detail of what might happen either way. So we're ready for that. Then in September, we have the 2 budget hearings for this budget.
Thank you. Anybody have anything else?
I have one other question for Debbie.
Yes,
On the employees that are not covered by health insurance, are they covered by the pension costs?
yes.
So they do have, okay. Thank you.
Okay.
Oh, one other question. When would you like recommendations on your budget?
Anytime.
Well, you don't want it the day before we vote on it, so.
No, I would say, and I think Brad, am I out of turn saying we'll be meeting with everyone this summer, but as you come up with ideas, please just, I know you've got my
Debbie and I are
email
gonna try to
and
have one-on-ones with each board member. We'll come to you and in July, hopefully, by the end of August. And yeah, certainly by the end of August.
yeah, the sooner I can price things out for you and look at it, the better.
All right, thank you.
Okay, next up, Julie Lupus, our Director of Accounting, gonna walk us through the reports for April. Hi, Julie.
Good morning, everyone. Julie Lupus, Director of Accounting. So we're looking at April's financials, and we finished with a $2.68 million net deficit, which is $712,000 favorable to our budgeted deficit. Revenue is $317,000 favorable to budget, driven by the timing of property taxes. Expenses are $394,000 favorable to budget, driven by salaries, insurance, and fringe expenses. When we turn to the April year-to-date financials, we finished with a $36.9 million net surplus, which is $973,000 favorable to the budgeted surplus. Revenue is $388,000 unfavorable, driven by the timing of a couple of the trolley contracts and the Tampa Bay Ferry not being in service yet. Expenses are $1.3 million favorable to budget, driven by services and privatized transportation. And if anyone has any questions?
Thank you, Julie. Great report as always. Any questions for Julie? Okay, seeing none, we'll move on to other business. Does any committee member have any business to bring before the committee at this time? All right, seeing none, our next meeting is July 15th at 9 a.m. and we are adjourned. Thank you, everybody.
Thank you.